medicine is not really designed to look at and address the mind-body connection. It's designed to address crises. And it's not necessarily there to cure disease, it's almost there to manage disease. And the more I sit back and observe, I see a basis of a great deal of pain, medical dysfunction, goes back to childhood trauma, and current stressors in people's lives that manifest with unresolved childhood trauma. Hello, my name is Ross Halpern. I'm a PhD clinical psychologist, and I am called a pain psychologist, a health psychologist, or a mind-body psychologist. And I've been doing this since the early 90s, and I have performed more psychological evaluations than any psychologist in history, close to 30,000 psychological evaluations. I've been on staff at 5 different hospitals. I taught at a major university regarding the mind-body connection for 10 years, and I've worked with hundreds of physicians. And because I'm a PhD psychologist, and I'm not an MD, I'm not a physician, I've been able to be immersed in the Western medicine, the medical system, working with thousands of physicians, but I can sit back and observe. Since I'm not a physician, I don't have to worry about a misdiagnosis of life-threatening illnesses such as cancer. One of my closest friends, who is a physician who teaches at a major university in the medical school, believes that almost 90% of all illnesses have a stress component or a mind-body component. The mind and body are very important, but we're not set up in Western medicine to address this. We're set up to treat crises and manage disease, but not necessarily there to cure disease, prevent disease, or address the mind-body component of a disease. Another close friend of mine is a hospitalist at a fantastic university, and she's a great physician. She was top of her class in med school, and she evaluates patients, and she tells me the way she gets a raise every year or gets a bonus is based on patient satisfaction surveys. And it sounds great that the physicians' bonuses are based on patient satisfaction, that they really have to treat their patients well to get a bonus. But the problem with this is the physician tells me sometimes the only time she can get a raise if she approves them for handicap parking stickers, supports their claims that the auto accident was the cause of their back pain, gives them all the opiates they want. And sometimes this physician believes that there might be a stress component to their pain symptoms or playing a major role to their pain symptoms. And she might say, before trying these procedures or before trying these opiates, which can be very addictive and dangerous, I'd like you to see my colleague, this pain psychologist, to take you techniques to nullify the pain or control the pain. And if she recommends this, sometimes patients will give her a bad review and say she's not listening because they want opiates and she's not listening. She's referring them for psychological evaluation. So it's almost a deterrence for her to do what she feels what's in the best need for the patient. If a physician refers a patient to a pain psychologist and they misdiagnose a major disease, the physician can be sued. So they're very hesitant at referring to pain psychology at first, which may be appropriate, but we've had such great luck working with patients, and many patients we've been able to get off their pain medications, increase their mobility just by addressing the mind-body issue, that it is an integral part of the treatment. And sometimes the problem, by the time they get to us, they're often been on opiates, and they've been addicted to opiates for years, so if they're taken off opiates cold turkey, their pain will go through the roof because they're tolerant. They may have also had 2 or 3 back surgeries, so they have metal in their back and scar tissue. and they're disabled, and they have also often other side effects because they're depressed, they're not working, they're on antidepressants, they're not sleeping, they're on sleep medication. And underneath all this is often an emotional issue that was never addressed from the beginning. It was the elephant in the room that played a role in causing all their health problems, but now it's covered up in this layers of healthcare and medicine. So sometimes we need to unravel all that with a team of physicians before we can get at the core trauma, before the patient can completely move forward with their healing and their life. Thank you. We'll talk more about this next time.